Hello everyone, welcome back to our channel. Today, I have a special treat for you as I bring you a comprehensive list. So, let's jump right into it. Of 11 drugs that can be fatal for you and your family. So stay with the video until the end. So you know if you have these drugs at home, because I'm sure you have several. And for you to start thinking once, twice, 3 times, even 10 times before you decide to take one of these remedies on your own, okay? But first I want to ask you, scroll down in the comments, subscribe to our channel, click on the little bell to activate notifications, leave your like. When you leave a like, this video is shown to more people here on YouTube and you help our channel grow a lot. You've heard the phrase, which is very well known. I don't like to use many well-known phrases, but everyone has heard this one, that the difference between medicine and poison is the dose. And it's really true. Sometimes you use something that's good, but if you use too much, it becomes poison. For example, lemon. Lemon is a blessing, it's a medicine, but if you use lemon all day, it can cause problems with your teeth, it can cause stomach problems. So the difference between poison and medicine is the dose, but in some medicines, this difference is very small. That's the problem. Every home, every family, has a hypochondriac. That person in the family who knows everything about medicine, that person who takes medicine on their own, but they don't take medicine on their own. She takes it and passes it on to others too. My mother, for example, was like that when she was a child. My mother gave medicine to everyone, and she wanted to help everyone. She loved it. I'm talking about pharmacy medicines, but apart from that, there are still some pharmacy clerks. I've seen this a lot in the countryside. The countryside, there was a shortage of doctors, and then the guy would go to the pharmacy, he couldn't find a doctor, he didn't have the money to pay for a consultation, there was a disgraceful SUS queue. He'd go up to the counter and say, I'm feeling this, and the clerk would pass. I'm not going to criticize it because it was necessary, unfortunately. But let's move on to the list of medicines. First of all, I want to know which ones you use. First of all, painkillers. Yes, my friend, I'm talking about Pyrone here. I'm talking about AS, pain medication. Painkiller. The first problem with painkillers is that you have to understand, for God's sake, that pain is necessary to treat yourself. If you can't feel a toothache, there's something wrong with you. You can't feel any pain. This is often an unusual reflection of your life. You're not very tolerant of pain. Oh, you can't have a headache, my love. You have to take a pill? You mean you can't stand a headache for half an hour? You don't have the patience to drink a glass of water with lemon, get some sleep, have a massage, take a warm bath? You have to take a painkiller? What's the big problem with painkillers? The biggest problem of all is that it masks to the pain, which may be necessary for you to discover your problem. Come on. If you have a headache every day, I'm not saying that's the case, then you're going to have to take Pyronone, right, Osaldina? You could be hiding a brain tumor and you don't really know how to solve it. Go to the doctor, get an MRI. I've seen cases of death of people who had a stomach ache. They took Buscopan with Pyronone. It passed. The next day the stomach ache came again, they took it again. Do you know what it was? Appendicitis. It burst, strangled, generalized infection. 11 surgeries. This patient had 11. So painkillers and masks are the problem. Dayan, you mean I'm not supposed to take medicine ever? I'm not saying that. I'm telling you to think twice before taking it. Only take it if it's the right thing to do, and preferably with a doctor's prescription. The second remedy, which women usually take when they're going to a wedding, days before when they want to dry out, reduce their measurements. It happens, you know, if you do this, you're taking a risk. Bodybuilders also use Furosemide before competitions. Furosemide, trade name Lasix. Is it a good medicine? But if you're going to use it to lose weight, you'll dry out, you'll dehydrate. You won't lose weight. Will you reduce your measurements? Yes, because you're dehydrating. This can lead to hydroelectrolytic disorders, sodium, potassium, magnesium. You could have cardiac arrest, arrhythmia. Guys, there have been cases of bodybuilders dying before a competition. Right? So let's be careful with this, very careful. Furosemide is very serious. It's a serious medication used for people who have kidney problems or high blood pressure. Secondly, furosemide. The third medication is muscle relaxants. Those little relaxants you use or take a muscle relaxant. Muscle relaxants are very dangerous. It can make your mouth dry and make you delirious, coma, and death. Right? So be careful with muscle relaxants. I don't know why people take so much medicine, kid. I don't know. The fourth medicine is Prednisone. Prednisone is wonderful because it gets rid of everything. You're short of it, it gets better. You have shoulder pain, it gets better. Corticosteroids make everything better. But guys, people use it for infinite purposes. And prednisone, it can affect your cholesterol levels. It can also mess with hydroelectrolytic disorders, right? It can mess with your blood sugar. I don't know why corticosteroids are sold without a prescription, okay? I don't know why, right? Fifth medicine. I saw my brother Icaro using it here at home this weekend. I used it in my childhood. My father used it a lot. I know a lot of people here use it. You're at the weekend, you've eaten feijoada, you've drunk, you're upset, you've got gastritis. What do you use? Fruit salt. Those 2 little envelopes of fruit salt, they contain the daily amount of sodium you need. So it can mess with your blood pressure. It can change the pH of your stomach. And in the long term, reduce the absorption of nutrients. And decrease acid production. And you'll have a diminished acid barrier. You'll get more intestinal infections. So forget about this fruit salt business. Do you have a stomach problem? You have to think about what you've done and tackle the root cause. The sixth dangerous remedy. Those women who get mycosis of the fingernails. I say women because women are my audience here, the majority, but men too. You know that little mycosis on your nail? You go to the manicurist, you take it and it won't come off even if you pray hard. Then your friend says, woman, I cured myself with fluconazole. You only take it once a week. Then you take it once a week for months. Because it doesn't come out like that. And then this drug, it forces your liver. And the liver, it doesn't show any signs that it's bad. The liver goes little by little. When it starts to show symptoms, you already have liver failure. And then it's dangerous to die. Okay, don't use fluconazole without a prescription. The seventh medicine, which you probably also have at home. That's what I've been talking about here, Omeprazole. Omeprazole, if you use it long term, can cause a deficiency in your magnesium levels, which is extremely important. It can even lead to stomach cancer. Omeprazole has been used for more than 8 years for stomach and intestinal cancer. Reduced B dose levels, including dementia, right? So be very careful with anemia. So omeprazole, do everything you can not to use it, especially in the long term, right? Another drug that I wasn't even going to talk about so much, but I'm going to tell you about it today. Be careful, I was only going to say 11. But these nasal sorbents to unclog your nose. Even babies use them, but there is a serum. I can't mention the commercial name here, okay, people? But there's a serum that has a substance called napazoline. Napazoline, the kind that makes tichichi. Right? So it can increase your blood pressure and even cause heart problems. Let's go. The eighth dangerous drug is nonsteroidal anti-inflammatory drugs. You know who I'm talking about, don't you? Diclofenac, ibuprofen, meloxicam, nimesulide. These drugs can also lead to ulcers, digestive bleeding, kidney problems, can lead to anorexia, loss of hunger, abdominal pain, nausea, vomiting, increased transaminases, liver enzymes. If these transaminases are high, you need to talk to your doctor, regardless of the medication you're taking, right? Doflex is one of them. Except that Doflex is a mixture of anti-inflammatory, in other words, an analgesic with a muscle relaxant. Okay? So those are the anti-inflammatories. Most people take them as soon as they feel pain, they're taking them. Ninth medicine. This one's too much. Everyone takes it on their own. All you have to do is sore your throat, cough. I'll take an antibiotic on my own. It could be azithromycin. People are And that's because it's forbidden, see? You have to have a prescription, but people find a way. Because you buy them, you don't take them all, you keep them in your drawer at home. So antibiotics lead to resistance. Boy, you have an infection, you have to go to the doctor to find out if it's an infection. If you have a cough, a high fever, greenish phlegm, that's fine, but it's up to the doctor. Each bacterium in each part of the body has a specific antibiotic. Antibiotics lead to resistance. When you have another infection in the future, it won't work anymore, see? Then, when you get the third one, you'll have to go to the ICU. So people take them because they have an earache, a cough, they take them on their own. Antibiotics kill the good bacteria in your gut. It interferes with your immunity. Then you don't know why I keep getting sick. My family spent the weekend here with me, they're all sick. I don't even know what it is. But the main antibiotic, I want to make it clear that people use a lot, is amoxicillin. Amoxicillin is in the penicillin class, and people take it for everything. Earache. So people be very careful with amoxicillin, it's not that innocent, okay? So I brought two more here for you. Rivotril. I know a lot of people here use Rivotril to sleep, to calm down. But what's my biggest fear about Rivotril? Firstly, the memory issue, it creates a hole in your head. But the main thing I see is the association between Rivotril and alcohol. A lot of people drink at night, come home afterwards, and take Rivotril. This can cause respiratory depression and you could die, right? I've seen cases like that. The person drinks, has no heart disease, nothing. He drinks, goes partying, comes home at night, and I've made a lot of mistakes myself. I've made a lot of mistakes. I've taken a lot of risks. I don't do that anymore. What did I used to do? I was afraid of airplanes, panicked. What did I do? I flew. I never stopped flying because of fear. But I used to fly. I used to take Rivotril. I used to take 4 0.25 milligram tablets. I still remember it as if it were today. It was a gram of Rivotril. And when I got up there, I still got drunk, so I wouldn't be afraid to fly. So the risk I took of not having a respiratory arrest up there in the plane and not having anyone to help me. So don't do that. And the last medicine, I couldn't fail to mention Simvastatin. I could talk to you all afternoon about Simvastatin, but I'll just say one thing. It's a drug that lowers cholesterol. Cholesterol is used for everything. For cell membranes. Cholesterol is used to make your sex hormones. It's used for your brain. Your brain is made of cholesterol. So think with me. Simvastatin. You'll lower your cholesterol. You'll lower your HDL cholesterol levels. You'll lower your hormones. You'll have impotence, a drop in libido, premature aging, and you'll get dementia. In addition, your liver enzymes will be altered, TGO, TGP, not to mention muscle pain. Apart from which is necessary for life. For life. To make energy in the mitochondria, I don't want you to take your prescription now and tear it up. I want you to watch this video. Don't believe what I've said. Go and study, right? Go study and talk to your doctor. Big hugs to you. Live healthy. Live with passion. With God in your heart. Love to you. And share this video with all the WhatsApp groups you know. And in your stories too. Bye, guys.